So you had surgery probably around 4, 5, 6 weeks ago, and now you're having a stitch reaction. It looks like a pimple. There might be pus coming out from it, which typically actually is stitch material. But in any event, you're nervous, you're scared, the office is closed. What do you do? So in this video, I'm going to talk to you all about spitting stitches and what I discuss with my patients. So stay tuned. All right, well, welcome back. My name's Adam Rosen. If you have not already subscribed, please subscribe to the channel. You can even check out and follow my Facebook channel for more information about topics like this. And if you enjoy these videos, click the thumbs up button. Helps people like you find videos like this. So I have a lot of information that goes out to my patients digitally in an app format. So every few weeks they get the appropriate information, which might be important around that time, either before surgery or after surgery. And I believe, if I remember correctly, around 5 weeks, my patients get a little push about information, what we call spitting a stitch. Now, whether or not you have shoulder surgery or back surgery or hip surgery or knee surgery, it is not uncommon for surgeons to use a stitch called Vicryl. And what Vicryl looks like is thin white dental floss, and it typically absorbs underneath your skin. But it's useful for us helping to close the skin after surgery. Unfortunately, for some people, they may what's called spit a stitch. Sometimes it's referred to as a stitch reaction, or sometimes it's even called a stitch abscess. And what you will see typically is what looks like a small pimple developing directly in line with your incision. The incision may have been healing well and uneventfully, and it's right around 4, 5, 6 weeks where people get these reactions. I have seen patients have 1, I have seen patients have 2 or 3, and I have seen patients have a dozen or more. We're not exactly sure why this happens. It is felt maybe that some people do react to the stitch material, in which case you would expect to see every single stitch cause a reaction. Sometimes we believe that a stitch may be placed too close to the skin, or maybe the knot when it is tied is a little too bulky. And as your body starts to absorb it, the way I describe it to my patients is it's kind of like you're a kid and you skin your knee falling off your bike and you get gravel underneath the skin. And weeks or months later, your body says, I don't like this. I'm going to spit it to the surface and get rid of it. And your body kind of does the same with spitting a stitch. Your body doesn't like it, so it tries to get rid of it. And if the stitch is not completely dissolved, what you commonly will see is this thing that looks almost like a pimple, and then what looks like commonly in a pimple, this pus coming out, you'll see this white kind of liquidy material come out. And typically it's not pus. Typically it is the dissolved stitch material. But in any event, it's concerning. So for patients that have already been cleared to get back in the pool or back in the hot tub or back in the ocean, the first thing we say is, time out, put this on hold. And I even let my patients know, like if it's 10 o'clock at night, they're aware that this might happen. I tell them, like, don't freak out and go to the ER. You can if you'd like, but treat this, and we kind of teach them what I'm going to teach you here in a moment, and just call and let us know first thing in the morning so we are aware. Sometimes they send a picture. Sometimes I have patients just come in so I can set eyes on it. But if they do spit a stitch or spit stitches, what we typically do is treat it with an antibiotic ointment. So something like Neosporin or bacitracin, you'll typically put that on 3 times a day. You might cover it with a Band-Aid, especially if you're wearing pants so it doesn't rub on the skin, and essentially just keep the area clean. It's okay to normally shower. We want you to use soap and water because bacteria normally lives on our skin, and we don't want skin bacteria to find its way inside this tiny little pinhole while your body is trying to heal it. And most patients with triple antibiotic ointment treatment and or a Band-Aid, within 2 or 3 or 4 days, usually it heals itself over. Now, occasionally you're a surgeon, and occasionally I have put patients on antibiotics. Instead of just like a little red spot and a pimple where this stuff came out and it otherwise looks clean, they might be developing a little bit more redness around the incision. There might be concern for cellulitis developing, and because you recently had surgery, there's always a concern for a surgical site infection. So in certain instances, your doctor may choose to put you on a course of antibiotics. Now, it is rare, but occasionally people have a stitch reaction, but the stitch doesn't really come out. It's not fully dissolved. They'll see this thread basically sticking out, And in those cases, patients will sometimes come in and we can remove the stitch in the office. Usually this is just a matter of kind of plucking it with some surgical instruments and pulling. It usually comes out quite well. Rarely do we have to do anything more to kind of cut the stitch and remove it, but usually once the offending thing is removed, that little hole with the same treatments we talked about before, triple antibiotic ointment and occasionally a Band-Aid on top of that, allow the skin to heal uneventfully. So I hope this short but sweet video kind of put your mind at ease. If you are having a stitch reaction, reach out to your surgeon's office. But at least now you know a little bit more about why it is happening and what you can do to initiate treatment. So thanks again for watching. I'm Adam Rosen. Until next time, stay safe.